Hey guys, it's Ashley Francis with Blue Sage Counseling and Wellness, and today we are going to talk about a really important subject, and that is trauma. I know we all have our own conceptions of what we think this word means, how it's experienced, and how to treat it. But what I want to do today is I want to clarify exactly what is trauma to help you be able to understand how to recognize it, also to be able to distinguish it from other different types of mental health conditions, how to treat it, and when to get help for it. So oftentimes clients will come into my office and all they know is that they're suffering, they're in pain, and they don't understand why, they don't understand where it's coming from. Sometimes they might have a little bit of an idea, but there's a lot of mystery. And what I find is that a lot of the suffering has to do with not understanding what's happening and where it's coming from. So what I want to take care of today in today's video is to be able to clean that up a little bit, to give you an idea of whether or not what it is that you're struggling with right now. Is it trauma? Is it depression? Is it anxiety? Is it a mood disorder? What is it exactly that it is that you're struggling with? We're going to put the focus on trauma during today's video to be able to rule out is it trauma or is it not. First, let's start with a very straightforward definition of what trauma is. It's a deeply distressing or disturbing experience that can result in physical and or psychological injury. Traumatic events can be extraordinarily stressful and can shatter your sense of security. They often involve a threat to your life or safety, but it can be any situation that leaves you feeling overwhelmed and isolated. So here's a really big defining factor. Oftentimes people think it has to be something that has been a threat to my safety. It has to be an actual event. That's not necessarily true. It could just be anything that leaves you feeling overwhelmed or isolated. So even if you've been under a tremendous amount of stress for a long period of time, that could actually be a cause for trauma. Keep that in mind. The more frightened and helpless you feel, the more likely you are to be traumatized. Let's talk about that for a second, that not everyone that experiences a traumatic event will be traumatized. And there are a variety of things that go into this. One of which is a sense of resiliency. And here's something that's interesting, is that our sense of resiliency, studies have shown that there is a great heritable aspect to that, meaning we are born with a certain level of resiliency, the ability to bounce back from certain issues. There may be something that's happening underneath the surface on the DNA level, the genetic level, that you really don't have any control over it. So you just may be more predisposed to not be able to bounce back from situations as easily as others. I know that's not very encouraging news, but it can be really helpful in being able to understand that there's some of this that's kind of out of your control. But there's also a great deal that is in our control, and that's what we're focusing on today. Also, there's different protective factors that people can have in their lives or they don't. The more supportive friends and family that you have, the more consistency that you have, the more predictability in your life, the quality of the support that you have, not just friends and family, but it could also be coworkers or HR. It could be clergymen, it could be a counselor. A lot of these things also factor into your ability to recover from the trauma. Let's talk about what it is caused by, psychological trauma in particular. So we put these into three categories, one of which is a one-time event. This could be an accident, an injury, a violent attack, especially if it was unexpected and or happened in childhood. Like I said, this is just a one-time event. 9/11 is a good example of this. Any sort of terrorist attack, a car accident, this is a one-time event that could lead to traumatic symptoms. And the next is ongoing relentless stress, as we mentioned earlier. Living in a crime-ridden neighborhood, battling a life-threatening disease, experiencing traumatic events that occur repeatedly, such as bullying, domestic violence, or childhood neglect. So this would be a cumulative effect of being in an unsafe, stressful environment. Oftentimes this is in childhood. Many people are able to get out of those types of situations as they get older. Some don't. And that may be the time when these traumatic symptoms might show up, is actually when they're out of the situation. They're in survival mode for so long that they don't have a post-traumatic stress experience until after they're out of the environment. This isn't always the case, but we oftentimes see that. And then lastly, some commonly overlooked causes are surgery, especially during the first 3 years of life. The sudden death of someone close, the breakup of a significant relationship, a humiliating or deeply disturbing experience, especially if someone was deliberately cruel. So there again, this does not have to be anything that is a major trauma like war or, as we were talking about, any accidents or injuries. It just could be something that you experienced that was more stressful than you were able to handle. It can leave an after effect. So your risk factors for trauma: if there is a heavy stress load, if you recently suffered a series of losses, that might be too much for you to handle. If you've been traumatized before, this is a big risk factor, especially if the trauma occurred in childhood once again. So childhood trauma can result from an unstable or unsafe environment, separation from a parent, a serious illness, intrusive medical procedures, sexual, physical, or verbal abuse, domestic violence, and neglect. So those are the most common factors that contribute to trauma and also post-traumatic stress. Okay, so let's talk about some of the psychological trauma symptoms. This will help you be able to rule in or rule out what it is that you're dealing with is trauma. Shock, denial, and disbelief, confusion, difficulty concentrating, anger, irritability, and mood swings, guilt, shame, and self-blame, withdrawing from others, feeling sad or hopeless, feeling disconnected or numb. And let's just keep it going. We're going to get into some physical trauma symptoms. Insomnia or nightmares, fatigue, being startled easily, difficulty concentrating, racing heartbeat, edginess and agitation, aches and pains, and muscle tension. Keep in mind that there can be an overlap of symptoms, these types of symptoms, in other mental health issues or disorders as well. So the defining factor to be able to say whether or not it's trauma is that there was something that happened or a series of things that happened that were exceptionally stressful, put more stress on the mind and the body than it's used to being able to handle. How long does it take to heal from trauma? This one varies, but typically what we say is a few weeks to a few months. Symptoms tend to ease as time goes on. This is typically the case. However, it's not uncommon to have a resurgence of symptoms during anniversaries or of the time of the trauma that it happened, or anything that reminds you of the event. So you could be going through life and feeling completely fine and not having any symptoms whatsoever, and then experience something in life that reminds you of the past trauma, and it literally can come out of nowhere. This is also another hallmark of trauma, is that you felt like you were fine before, and then it literally just came out of nowhere and took you off your feet, and now you're struggling with a variety of symptoms. We know that in many cases people do heal on their own. That is the good news. But sometimes that's not always the case. And if this is the case for you, please know that there is no shame in that. It doesn't mean that there is anything wrong with you, or you're defective or weak or less than other people. It just simply means that you're wired a little bit differently. Your interpretation of things might be different. And it's just a matter of being able to get that trauma to be digested, to get it to move through the system so that you can get back to living your normal life. When to get help for trauma? If your symptoms do not appear to be getting better, or if they become worse over time. If you continue to experience trauma symptoms for prolonged periods of time, you may be experiencing post-traumatic stress disorder. We're not going to get into the nitty-gritty of PTSD right now, but just know that if you're not recovering and it stays with you for months or weeks to months, it could be post-traumatic stress disorder. So this happens when the nervous system gets stuck, meaning you remain in psychological shock, you're unable to make sense of what happened and process your emotions. And that is by far the most common thing that I hear clients say is like, I feel stuck. I can't get out of reliving or re-experiencing these past things, and I don't know how to do it. How to start healing now. Here are the practical, tactical things that you can start doing on your own without professional help to start feeling better now. understand that trauma disrupts your body's natural equilibrium, and thus it freezes you in a state of hyperarousal and fear, as well as burning off adrenaline and releasing endorphins. Exercise and getting yourself moving is by far one of the best things that you can possibly do. So we recommend a minimum of 30 minutes of exercise most days per week. And if you can't do that all at once, then we recommend breaking that into 10-minute spurts 3 times a day. Also, exercise that is rhythmic. Anything that engages both your arms and legs, such as walking, running, swimming, basketball, or even dancing. This is one of the best things that you can do to get your nervous system unstuck. You also want to add a mindfulness element. So instead of focusing on your thoughts, you're actually focusing on how your body feels as it moves. And your feet are hitting the ground, the rhythm of your breath, feeling the wind on your skin. Things like rock climbing and boxing and weight training and martial arts are really good ways to be able to channel into this as well. So you're not so focused on what you're thinking, you're not getting sucked back into work situations or things from the past. You're actually focused on your body, and when your body's too busy, it doesn't have time or the ability to focus on all of those other distracting thoughts. The next is don't isolate. This is a really tough one. That is the go-to after we've experienced a trauma. Please understand that if you just experienced the trauma and you feel very withdrawn and scared to go out in public, it's okay for the time being. That's a-okay, but we just don't want to stay there. So we want to acknowledge that isolation is going to make it worse. Connecting face-to-face will help you heal. You don't have to talk about the trauma. In fact, sometimes that can make it worse. So if you want to hang out with friends or family and don't want to talk about the trauma, you can make that very clear to the people around you that, in fact, this is going to make it worse. I'd really rather not, but I do need to be talking about something. Reconnect with old friends. Just having someone to talk to and listen to can really go a long way. Join a support group for trauma victims. Nobody understands exactly what you're going through like other people who are going through similar things. Trauma is such a unique animal that it's hard for other people that haven't experienced before to understand and be able to relate to you. But other people that have can understand exactly what you're going through, and it helps you to feel less alone. Volunteer. So this is one of the best ways to get out of your head and making everything so personal and being stuck in unhelpful patterns or the nightmares or the flashbacks. Be able to volunteer and get outside of your comfort zone. It challenges that sense of helplessness when you help others. Oftentimes when we suffer from trauma, we feel helpless. So we're actually challenging that helplessness by putting our attention towards other people. Make new friends. This is also a really good way. You can take a class or join the club. Again, these are just more extensions of being able to get out of your head and making connections with other people. Okay, the next thing is to self-regulate your nervous system. So this may be the chunk of things that you want to do first versus getting out of your comfort zone and volunteering and being more social. I would actually recommend starting with regulating your nervous system first. No matter how out of control you might feel, you must know that you can change your arousal system and calm yourself. This is a big misconception. A lot of people think that my nervous system is in the driver's seat and it is in control, and I have no ability to be able to regulate myself. This is a misconception. That's simply not true. It takes a little bit of time, but being able to retrain yourself to understand that you actually do have the ability to be able to handle these things, it can go really far. Just a switch in that mindset can go really far. And it will also give you a sense of self-control. So what we want to do is mindful breathing, where you take a long, slow, deep breath in through your nose and out through your mouth. You want to do this a series of 4 to 6 times. Start with mindful breathing. The next is sensory input. So this is when we experiment with specific sights, smells, or tastes that make you feel calm, such as petting an animal or listening to some calm music. Anything that we are able to do, once again, to get out of our heads and to get into our bodies or paying attention to the environment is good. The next is to stay grounded. So what you want to do is sit in a chair with your feet flat on the ground and your back up against the chair. And what you want to do is you want to look around your environment and pick 6 objects that are either red or blue. There are so many different varieties of being able to do this exercise, but what it's essentially doing is that it is helping you to notice how your breathing gets deeper and calmer when you're able to focus on other things other than your intrusive thoughts or the flashbacks. And then finally, you want to allow yourself to feel what you feel when you feel it. This is a really important one. Oftentimes we want to push it away. We don't want to think about it. It's too much. But actually, it's that resistance in and of itself that's keeping you stuck. So if you have the ability to be able to really sit there and allow yourself to feel what you're feeling, to think what you're thinking, and just let it be, that's a much better approach than trying to push it away, because that's actually helping the digestion and the movement of the trauma that's become stuck in your body. Again, this may be a whole lot easier said than done, and especially if the trauma just happened, you may not be able to do that, and know that that's okay. It's something to work towards. And then finally, you just want to take care of yourself. A healthy body can increase your ability to cope with the stress. And that's the whole idea here, is making it so that your body is better equipped to deal with the stress, because that's exactly what's happening when you've experienced trauma. So you want to get enough sleep, shoot for 7 to 9 hours, avoid alcohol and drugs. This is a tough one because in the short term, it can help with calming the nervous system down and numbing things out. But in the long run, it's actually wreaking havoc on your nervous system and it's making it worse. Eat a well-balanced diet. It keeps your energy up and it minimizes your mood swings. Reduce your stress by practicing relaxation techniques such as meditation, yoga, and deep breathing. Those are all things that you can do right now on your own, and you can start feeling better right away. And if these things work, you may not need professional help. Good for you. But if it is the case that you do need professional help, here are some ways to be able to tell. Everyone heals at their own pace. Please keep that in mind. It could take weeks or months. And if things are not starting to calm down and they're just not getting better, or they're actually getting worse, that's a good time to talk to a trauma expert. You want to seek help for trauma if you're having trouble functioning at work or home, suffering from severe fear, anxiety, or depression, you're unable to form and or maintain close, satisfying relationships, you're experiencing terrifying memories, nightmares, or flashbacks, you're avoiding more and more anything that reminds you of the trauma. You become emotionally numb and disconnected from others, and you start to use alcohol or drugs to feel better. Those are all things, and you don't have to be meeting the criteria for all of those things in order to seek professional help. There again, if you've tried some things and the level of fear is just insurmountable, you just can't live that way anymore, that's a good time to seek professional help. You just don't feel like you're equipped. The depression can get a lot worse, feeling as though I used to function a certain way, and ever since this has happened, I'm not able to function the way that I once did, and that can cause a great deal of depression. The anxiety of leaving the house or interacting with other people, you might be able to do it, but it's really hard to do, and it's taking a big toll on your body. We will talk about the specific ways that professional help can help with trauma in a separate video, but just wanted to give you guys an idea of what exactly is trauma, where it comes from, what causes it, who tends to suffer from it more, and also to talk about just some of those things that you can start doing now to start feeling better. If you enjoyed this video, please let me know by leaving a comment in the comment section, giving the video a thumbs up, and also subscribing to our channel to see more videos like this. Also, if you are a BSCW client, there is a write-up of everything that has been discussed in this video in the resource library, so please check it out.